We're going to get started. As many of you are aware, we've had some increasing numbers of COVID-19 transmission in the state. We thought it was important to get healthcare leaders in our state together to give you an update on community transmission trends and also answer your questions. So with us this morning, we have Dr. Michelle Hoffman, Utah Department of Health Deputy Director. From Intermountain Healthcare, Dr. Mark Breesacker, who is the Chief Physician Executive. From Mountain Star Healthcare, Dr. Mike Bauman, who is the Chief Medical Officer. From Steward Healthcare, Dr. Arlen Jarrett, who is the Chief Medical Officer. And from University of Utah Health, Dr. Kenzie Graves, who is the Associate Chief Medical Officer for Inpatient Care. So we're going to begin with some brief comments and updates on the situation throughout the state of Utah, and then we're going to open it up for Q&A. As always, please put your questions in the chat. And then immediately following this event, we're going to have Spanish-speaking experts to answer questions in Spanish. So with that, Dr. Hoffman, I'm going to turn it over to you for opening comments.
Good morning and thank you. We really appreciate our partnership with the state's health systems, and this is really a critical time in our COVID-19 pandemic response. I'd like to start off with framing the discussion with some data points. As of June 2021, we've had our third highest monthly caseload growth since the beginning of the pandemic. Currently, Utah has the sixth highest case rate in the nation at 8 per 100,000 people. Since June 1st, COVID-19 cases, percent positivity, and hospitalizations have all increased by at least 75%. This increase in COVID-19 transmission is largely being driven by the Delta variant, which became the predominant SARS-CoV-2 lineage in Utah during this month of June. Currently, we are sequencing about half of all positive cases identified in Utah, and 80% of these variants are Delta. This surge is largely in unvaccinated people who are being infected and hospitalized at 6 times the rate of vaccinated people. Unlike past increases, adults between the ages of 25 and 44 and 45 and 64 currently have the highest case rates, followed by those 15 to 24 and 85 plus. This indicates that most cases are in people who are eligible for the vaccine or who do not have the same level of protection, mostly in our elderly population, from having the vaccine. As I mentioned, these numbers are largely driven by unvaccinated people. The case rate is 6 times higher among unvaccinated people than among vaccinated. That rate is actually likely to be higher due to overrepresentation of breakthrough cases. Similarly, unvaccinated people are 6 times more likely to be hospitalized than vaccinated people. The frustrating part about all of this is that unlike last year, we have all the tools to stop this pandemic in its tracks. The COVID-19 vaccines work. We've made great progress in our vaccination campaign. In fact, we accomplished our goal of getting to 70% of adults with at least 1 dose before Independence Day, as well as our goal to get to greater than 25% of children aged 12 to 15 before Independence Day. But we frankly just need more people to be vaccinated. The highly transmissible nature of the Delta variant has changed the game, and we're clearly seeing this surge related to our unvaccinated populations. We can stop this surge before it gets worse. We can help keep our healthcare systems functioning efficiently, but it's going to require people who have not been vaccinated yet to do so now. Thank you.
Thank you, Dr. Hoffman. Over to you, Dr. Breesacker.
Thank you. Hey, it's really great to be here today with all of you. Michelle, thank you for the update. And, you know, I couldn't agree more about now is the time to act. And I think it's really important for those that are out there who have not been vaccinated to take a moment and take in some of the new information that Dr. Hoffman shared, as well as a few things that I'd like to share. I think most importantly, I'd ask everyone to keep asking questions and keep learning as you work through the decision, the personal decision, that you are making with respect to whether or not to get the COVID-19 vaccine. So a couple of things that are important to know. We know that immunity from being infected from COVID, which many people were last year, the immune response to that is quite variable among people, and it wanes over time. I know that many people who have been immune are now seeing that immunity wane as the time from their infection has increased. The other thing that we know is that the new variants are much more contagious. And if you were sick from COVID last year, you are at significant risk of getting reinfected again. The other important thing to know with respect to vaccination is that the immune response from vaccination is very predictable amongst all of us. And it is also important to know that that immune response does protect against the variants. So again, keep asking questions and keep learning. In my many years in pediatric practice, as you can imagine, this question came up for all sorts of vaccines. And my consistent advice is let's keep an open mind about these things and continue to learn and continue to resolve the questions that you have, resolve conflicting information that you're getting. Ask your primary care provider, ask your friends and family for their perspectives, and work to resolve any conflicting information that you might have with as many facts as you can gather. I have one other thing that I'd like to bring up, and that is the fact that when I think about our ICU nurses and our teams that are caring for an ever increasing number of patients with COVID these days, they've been at this for over a year. As we all emerged from the pandemic and got back to the new normal lives that we have, they still stayed in our hospitals to care for critically ill people. We're back on the roads. We're having car accidents. We're back hiking in our parks and boating on our reservoirs and walking around. And those activities give us the normal expected summer trauma season. So on top of the increase in COVID, we have an increase in the number of patients we're caring for who have been injured in any variety of manners and fashions. Our nurses, our techs, they are there for all of you. They come to work every day. And when they're caring for people with COVID, we know that many of them chose not to get the vaccine. And it's a sad situation to see someone so sick from that choice. Many of them express that they wish they had gotten vaccinated when they're in that moment. So I can't be more proud of our nurses and our critical care teams and the teams that are on our hospital floors. They are there for all of us across the state. And we really, my ask again, for those of you who are thinking about getting the vaccine, now is the time. There's just no doubt about that. With the variants, with the increase in cases that Dr. Hoffman shared, now is the time to make that decision. Keep being curious, and we are here to help you answer any questions you have about that. That's all. I'll turn it over to the next person.
Thanks, Dr. Briesacker. Dr. Bauman.
Well, good morning, and thank you for the opportunity to speak with you guys again today. I'd like to start with reinforcing that in the Mountain Division, we have 8 hospitals here in Utah, and it's called Mountain Star. We're seeing a slight uptick, but that matches what we look at on the Domo dashboard and other areas. And although that uptick is not huge, we've gone from roughly 20 patients in Utah in May and June to 30 yesterday within our hospitals, and a slight drop today. It is a gradual increase from May up to today. That uptick should get our attention. Although the numbers are smaller than perhaps other systems, it is a definite uptick. We need to pay attention to COVID. We need to not lose our focus. And COVID is an unpredictable disease. We've learned a lot in the last year and a half. And if anything, we know that this can change, and we've seen that with the Delta variant. We need to be very careful that even though it's not the surges that we saw back in December and January, and then February and March, this slight uptick could be the harbinger of a major problem here in Utah if we're not careful. And one of the things that was mentioned earlier is vaccinations. Vaccinations are key. I'm very sympathetic to people who do not want to have a vaccine. There are a lot of emotional challenges around this for some folks, and we're very sympathetic. I'm very sympathetic to that. But if you don't have a specific reason not to get vaccinated, medical or otherwise, I would strongly suggest this is the time to take another look. It is the best effort that we have available now to stop COVID. The information shows that the vaccine works very well against variants, including the Delta variant. There were 2 recent publications in Lancet and Nature that show that, and the durability is good. Something that was mentioned earlier that I'd like to reinforce as well is natural infection is not as important or as durable as getting a vaccine. Currently, I have a family friend in Reno, Nevada, who's been in the hospital twice with 2 separate episodes of COVID, and he has never gotten vaccinated. That's an example of having an infection, it not preventing a future readmission to hospital. So that is really key. The other thing I'd like to emphasize in this group of docs that's on the phone today, we were together last year talking about masking and social distancing. Vaccine's important, but if you're not certain, those simple measures are still important, particularly if you're in a crowd. And if you're not certain, still mask, still keep your social distance. Lastly, I'd like to reemphasize the ICU issue. Right now, our ICUs in our 8 hospitals are showing a gradual increase in the numbers of patients. Some of that is COVID, but a lot of it is the care that's been pent up. Many people have not been able to get the care they wanted or were afraid to get the care that they needed, and that often involves an ICU stay. We're also seeing an uptick in our floor beds being used that are non-ICU. It's important to keep those open for non-COVID patients to get this care. Some of it is indeed new things, new accidents, new heart attacks, new pneumonia, but some of this is people that have been waiting for COVID to wane so they can get their care. It's very important to keep those beds open so that our patients, our family, our friends can get the care that they need. So I'll end with this. If you've not gotten vaccinated, now is the time to think about it again. It's probably the most effective, most important thing we can do to prevent COVID from spreading. And here in Utah, where you've heard that we have a lower vaccination rate, to keep us, our fellow citizens and our friends safe, please go get a vaccine and take this time to rethink about vaccinations.
Thank you, Dr. Bauman. Dr. Jarrett.
Thank you. So I'm Dr. Jarrett. I'm the Chief Medical Officer for the Steward Healthcare System here in Utah. We have 5 hospitals. And I want to thank the Department of Health for putting together this opportunity for us physician leaders from the various health systems to get in front of the public and have one more conversation with everyone about the COVID situation. At Steward, we continue to be able to admit and give excellent care to patients with COVID, just as we have done throughout this entire pandemic. We did have a much needed respite for our nurses and doctors and staff from March to June. Interestingly, though, during those 4 months, we did keep us a very steady and significant census of patients with COVID in the hospitals. We never dropped to 0. But something happened in our system that is unique, it sounds like, compared to what I've heard so far. 2 weeks ago today, we saw the number of COVID patients in our hospitals, the number of patients who are sick with COVID in our 5 hospitals increase by 110% overnight. It more than doubled overnight. And that number has persisted for the past 2 weeks. To say it another way, our hospital capacity, our hospital census of COVID patients is at nearly the same level it was during the worst part of the winter surge. That's a unique phenomenon that we're experiencing. And I have a feeling that we might be an early indicator for what else is going to happen across the state. Currently, our ICUs are, all of our ICUs overall are at 80% capacity. Some hospitals are at 100%. The majority of these patients are not sick with COVID, as has been mentioned. There's a lot of other pent-up need, accidents, surgeries that have been waiting to be done. that are now getting done, and our ICUs are filled up with other patients, we do have the ability to expand as we did before during the winter surge. And if we need to expand our ICUs, we will do that. But we have a new challenge, and all of the hospital systems are facing these same challenges, in that it seems as though our workforce has been depleted or worn out. We're not seeing as many nurses and technicians and other people apply for positions at all places in the hospital. Housekeeping, dietary, all of the hospitals are struggling right now a bit with finding people who are willing to apply and accept those jobs. Now, we're not in any dire strait, but this is a new challenge that we're facing, and we're coming up with new ways and innovations for how we will address these. As has been mentioned by others, the people that we are seeing sick with COVID in our hospitals are overwhelmingly unvaccinated. And with this new Delta variant that spreads so much faster, it would appear that a choice to stay unvaccinated is very likely a choice to get COVID. Not a matter of if, but when. And so my appeal to the public is that to keep yourself out of the hospital so that we don't have to see you sick in our care, please get vaccinated now. It's never been more important. The end of this pandemic is within our grasp if we will just do our part. And thank you.
Thank you, Dr. Jarrett. Dr. Graves.
Good morning, I'm Kenzie Graves. I'm the Associate Chief Medical Officer for Inpatient Care here at the University of Utah. I want to echo some of the things the other physician leaders have said. The first thing I will start with, though, is painting a picture of what it looks like here at UHealth today. So this morning, we have a handful of open ICU beds. We have a handful of open acute care beds. We have patients boarding in our ED waiting to get in. We are clinically busier than ever as a result of people waiting to get care. So we are seeing that as well. Over the last 2 weeks, our COVID census, patients who have COVID-19 and are sick from that, needing hospitalization, that number of patients has doubled. As we watch our state trends increase, the thing our staff needs the most is for people who are unvaccinated to please get vaccinated now. That are sick, are young. We had a gentleman in our ICU that was under the age of 30. He was here for 3 months. We have the average age of our patients now is between 40 and 55. And so we are seeing a different patient than we saw before. This is especially difficult for our staff because we've watched suffering. We worked additional shifts. We stretched our ICU capacity by 20% over the last year. Now, for our staff to witness suffering that is preventable is heartbreaking for them. Like Dr. Jarrett, our staff is also slim. So we have a lot of open positions that we can't fill. Healthcare is included in the Great Resignation. We continue to provide excellent care, and we implore people to help us by getting the COVID vaccine and helping us protect our ability to continue to do that. I've been on call for the last several days for our hospital and taking screening calls for people admitted with COVID-19. The majority of those have been in their 40s, and they are all unvaccinated. And so here at the University of Utah, we provide excellent care. We want to continue to do that. We need the public's help in getting the vaccine. To do that, please talk with your primary care provider. Go to vaccines.gov. We need your help taking care of our patients.
Thank you, Dr. Graves. We're going to open it up for questions right now, and we already have several in the chat. So the first one, how many breakthrough cases in recent weeks have we seen, and are vaccinated people getting sick? Dr. Hoffman, I'm going to give this question to you.
Thank you, Kathy. Between May 1st and June 25th, 93% of our cases in Utah have been in unvaccinated people. That same number holds for the number of hospitalizations. 93% of hospitalizations have been in unvaccinated people, and 95% of our deaths have been in unvaccinated people.
Does anyone else want to add to that? Any of our hospital leaders? Dr. Baumann.
So we pulled information from one of our hospitals, and it's just to reflect on this again. 33 out of 35 of our patients in June at Ogden Regional Hospital were unvaccinated. One patient was a breakthrough, and the other patient had only gotten 1 of 2 doses. So it just reinforces that being vaccinated is really a key preventative to being hospitalized and potentially dying. So that's just one of our facilities that I got the most up-to-date data yesterday morning. So again, reinforce that we need to be vaccinated, and it will help prevent hospitalizations when we really need our beds for other things as well. It's important to take care of our COVID patients, but we have other patients to care for as well.
Okay, and we have a question about the Israel study that came out yesterday saying that the Pfizer vaccine, the efficacy has dropped to 64% against the Delta variant. Dr. Hoffman, I'm going to go back to you again on this one. Can you comment on that?
Certainly. So anytime a new data point comes out, we want to reach to that, and we have to be very careful around the timing of those messages. So the Israel data is only preliminary at this stage. It was gathered between June 6th and early July, so 1 month's worth of data. And so it's really too early to precisely assess the effectiveness against the Delta variant. We really have to look collectively across all data and not really hone in on one specific early figure coming from one country. This is a global problem. We have many people who are receiving the Pfizer vaccine, and we're increasingly becoming better aware of the impact that will have on the Delta variant. The reassuring point is that the vaccine manufacturers are well aware of these risks and are actively working on addressing that through booster doses. And so while we haven't yet made any movement on deciding whether we need to proceed with boost doses, it's a wait and see still. But certainly if this persists and we continue to see lower efficacy, we'll have to move in that direction.
Thanks, Dr. Hoffman. Another question from Sean Means. Governor Cox has said he does not intend to bring back mask mandates or business restrictions, and the legislature has shut down talk of incentives for people getting the vaccine. Programs are in place to encourage the hesitant to get vaccinated with varying results. What policy changes would you all, as hospital leaders, recommend to fight against this surge? Dr. Briesacker, I'm going to go to you on this.
I feel that this is such an important personal policy type of decision, and the facts are as we've outlaid them. The vaccine it works, it's effective, it's safe, and this is about everyone making that decision and continuing to work to understand the pros and cons for them personally, and continually moving towards resolving the questions they have, and then going and getting vaccinated. You know, the policy perspective with respect to things we did before, those were necessary because we did not have a vaccine. We have a definitive treatment, just like we have vaccines for measles and for whooping cough and for chicken pox and all the other things, tetanus. These are all things that we all get vaccinated for. And we do it for the simple reason that the risk of the disease is so high and the risk of severe complications is so high that it's worth it to get vaccinated. COVID-19 is the same way. So the policy here is simply let's get vaccinated at the highest level possible for our state.
Thank you, Dr. Briesacker. Dr. Graves, anything that you'd like to add to that?
Yeah, that's a great question. And so as a physician, I feel like for me to advise policy really isn't where I belong, but I will talk about what I know scientifically and what I have seen. What I have seen is that the majority of people we're admitting that are very sick are unvaccinated. We have a definitive tool to end the pandemic. We have a definitive tool to take care of each other, to keep each other safe, and that is the vaccine. I know there are people out there that are worried about that and worried about safety. We've seen millions of people be vaccinated over several months. The vaccines are very safe and very effective, and we are not seeing admissions at the same frequency as we are with people who have gotten the vaccines as those who have not. We're admitting people who have not been vaccinated. So I want to encourage everyone to get the vaccine. If you have not been vaccinated, I do think it's important to recognize that the Delta variant is transmissible and it is likely to land you in the hospital. And that, I think, is worth avoiding. So masking and social distancing is important if you're unvaccinated, but the more definitive thing to do is to get the vaccine.
Thanks, Dr. Graves. Dr. Jarrett, do you want to add anything to this?
You bet, Kathy. Thank you. So I'll just add, I think that the time has come, we're past the point of mask mandates and social distancing mandates as we've seen. I think that's behind us. But I think there are still ways in which we can develop policies that can help us move the vaccination program forward. I think there are still plenty of barriers that are keeping those individuals who really might get a vaccine from getting it. Now, we know that there are some individuals who are just never going to choose to get a vaccine. We can continue to educate and put information in front of them, but there are plenty of people, I think, still who would get vaccinated if the barriers weren't there. And we heard President Biden, I think, mention something in his plan about taking the vaccine to the people. And I think that's something that we could do with policy. We could do plenty of things to take down barriers. Some individuals maybe don't have the ability to take time to get off of work, or they don't have transportation, or they just don't understand where or how to go to get a vaccine. We're doing things inside of our hospitals now that will start to search for patients that haven't been vaccinated and offer them an opportunity to be vaccinated while they're in the hospital. We're also trying to stretch that out and find out if their family members or visitors who are with them have been vaccinated or not, and then find ways in which we can offer them, taking down again the barriers that kept them from getting vaccinated in the first place. I think that's a policy direction that we could take.
Thank you, Dr. Jarrett. Dr. Hoffman, a point of clarification for you. You mentioned overrepresentation of breakthrough cases. Is that just because people who have been vaccinated are more likely to get tested and report those breakthrough cases than people who haven't been vaccinated?
Yeah, Kathy, that's exactly right. We have seen these patterns in our surveillance data, survey data of the general public. The people most likely to wear masks still are those who've been vaccinated. And similarly, the people who are most likely to go and get tested when they have concerns over an exposure or symptoms of COVID-19 are more likely to be tested.
Thanks, Dr. Hoffman. A question here, is there a need coming for the state to mandate masks again, enforce social distancing, et cetera, again? What will it take to reach that point? Do you want to start, Dr. Hoffman, and then maybe we'll ask our other hospital leaders?
I think our other speakers has addressed this really well. We are in a very different place with an effective measure, public health measure that is universally available to all Utahns over age 12 and older. And it's a matter of getting vaccine to as many people as possible and those personal choices. Of course, as Dr. Graves mentioned, any individual who remains unvaccinated, we have another very effective public health intervention, and that's universal masking that we used to get through the worst stages of our pandemic. Very effective. It kept our children in schools. It works. And so every unvaccinated person should continue to be masking.
Thanks, Dr. Hoffman. Dr. Bauman, we didn't hear from you on this. Do you have any thoughts on this topic?
So I think it's been covered well, as was mentioned, that at this point, vaccinations are probably the most important and most effective and safe way to prevent COVID. For those that are unvaccinated, I think there's still an important role for masking and social distancing. Also, if you're just not certain, as I mentioned when I made my opening remarks, masking and social distancing are always an option for anyone to choose. But moving into that as a policy again, I think more important, our focus should be on getting people vaccinated. And frankly, kudos to Arlen and his comments around breaking down barriers. I think that's a key thing that we could move into here in Utah, is the ability to look at what policies could potentially help break down barriers.
Thank you, Dr. Bauman. A question here, are there other patterns you're pulling out, whether it be mobility related or other surveillance data about where and among which groups the virus is surging right now in this state? Dr. Hoffman, do you want to take that one, and then we'll give it to a few other hospital leaders?
One of the areas that we've really tried to get some more granular data this past week is around the age demographic. We've talked about low rates of vaccine breakthrough infections, but I think it's really important to note that there's differences in our immune response based on age. And among the unvaccinated, we see differences. So from the 12 to 18-year-old age group, those hospitalized, 98.7% are unvaccinated. But if you get into the older age groups, those highest at risk of death and disease from COVID-19 are 70 to 79-year-olds, are 82.2% unvaccinated in the hospital. That means they're having far more breakthrough cases in our elderly. Same for our 80 and older. 76.5% of those hospitalized are unvaccinated. The remainder are vaccinated. So we are seeing breakthrough infections in our older populations at a higher rate than we are on average across our population. And that's really important. We started in this pandemic recognizing that the most at risk were and most vulnerable were our elderly. Those individuals still remain our most at risk and our most vulnerable, even in the presence of vaccinations. And I know that many people have had loved ones living in nursing homes throughout the state, experiencing the devastation of COVID-19. Just think about our loved ones and the risk that this surge is posing to all of them.
Dr. Briesacker, do you want to weigh in on this? As one of the larger healthcare systems in the state, what kinds of trends are you seeing related to patients with the Delta variant?
Yeah, thank you. We're seeing, as with other systems, the same steady increase in cases across the entire system. Our ICUs down in St. George have been full for most of the past couple of weeks. Where, I was, it was disappointing to get on the call with my colleagues a week or so ago to reinstitute some of our processes around load leveling, the transfer of patients between systems as we all work to manage our ICU capacity. And in several of our hospitals, we're looking at decisions to reinvoke some of the waivers around different types of care that were present during the height of the pandemic, because we are approaching that level of care again. The patients we're caring for are younger. They are, as with every other, the most important trend here is this recurring theme of the people that are in the hospital have not been vaccinated. That by far is the message. That's the trend to make note of here. And again, I'll just, it's just, when it happens to you or to someone it's just so personal and so meaningful. I encourage everyone to just reflect and think about what they experienced when someone close to them got really sick or died from COVID, and what that might mean for them if it was right within their family, and incorporate that into your decision making. It's just the most important step any of us could take for each other and for our entire community.
Dr. Graves, do you want to comment briefly on trends we're seeing among hospitalized patients?
Yeah, I agree. So we are seeing the majority of our patients with COVID-19 are unvaccinated. So in this past several months, I believe we've seen maybe 1 or 2 that are breakthrough cases, but the vast majority are unvaccinated. That includes people from rural parts of Utah. The one thing I will point out, and Dr. Hoffman can add, is vaccine rates across Utah are quite variable. And so we have areas of high vaccination rates like Summit County and low vaccination rates, and often we see the people from those rural areas coming here and needing critical care.
Thanks, Dr. Graves. And I'm going to get to a few more questions here. I want to be mindful of shifting over to our Spanish language portion of this press conference, but a few more questions here. Dr. Hoffman, I think these might be best for you. So just following up what you said, so is there some type of behavior that's contributing to the spread right now among the unvaccinated, such as not wearing masks? And also, Is it fair to say that a spread among the unvaccinated young people is driving breakthrough infections among those who are already vaccinated? Can you comment on that?
Sure. So certainly we have a behavioral risk factor survey that we do, and we do know that those who are unvaccinated are also the most likely to be unmasked. So definitely our behaviors do drive the breakthrough cases. As Dr. Graves mentioned, choices around choosing to be vaccinated, differential rates of that in geographic areas across the state. We know that individuals in the hospital are vastly unvaccinated, and it is logical that they would be coming from places where they have lower uptake rates of the vaccine overall. As far as fairness, I mean, so there's individual responsibility, and then there's a sense of community altruism and our ability to collectively come together to do the right things. We know what tools are required. We know what it takes to slow the spread and stop the spread of COVID-19. Many places are doing that perfectly. We've got our nursing homes throughout the state. They're continuing to have very aggressive infection control measures in place, universal masking and the like. People know what the right things are to do. We have to call upon all Utahns to continue to do that. It isn't fair that a subset of our population is leading to surges in our disease, but we have to have a community spirit and altruism that I know Utah has. We come together to get things done, and this is one of those times that we need to do so.
And then the other part of that question is transmission among the unvaccinated driving breakthrough infections among those who are vaccinated. Do we have any data on that?
So I don't think we can get that granular other than the logical assumptions that people who remain unvaccinated are those who are getting infected at a higher degree by like 95% plus. And they're also the ones likely to be in the hospital and experience death. And so, yeah, it is fair to say that.
Okay, and again, wanting to be mindful to shift over to Spanish here. So we're just going to do a few more questions. I'm going to do rapid fire here. We have a question about, from Sean Means, do the hospitals you represent require employees to be vaccinated against COVID-19? And do we require employees to get vaccinated against measles, other whooping cough, other things like that? I'm going to go to everybody and just rapid fire. Dr. Breesacker.
We do not require the COVID vaccine at this time. We continually evaluate it. We do require vaccination for measles and tetanus and other communicable diseases.
Dr. Bauman.
We do not require COVID vaccines at this point in time. And I'll shift the second part of the question slightly. We are very interested in having people get vaccinated for flu, but we also don't require flu at this point in time, but do require employees to be masked if they have not been vaccinated for flu.
Dr. Jarrett.
We do not require COVID vaccination for our employees at this time, though we strongly encourage it. And we are looking forward to the time when it actually gets official and full approval from the FDA. We do require flu vaccination as well as vaccinations for the other communicable diseases for our employees.
Dr. Graves.
We also do not require COVID vaccination among our staff because it is under emergency use authorization. Like Dr. Jarrett, we closely watch full approval and will likely consider requiring it at that time. We do require vaccination for other diseases, yes. Okay, and we have two quick questions from Facebook, and I think Dr. Hoffman, you may be the best person for this one. And the question is, I know several people who have received the J&J vaccine and got a second dose of either Moderna or Pfizer. Is this recommended? Is it safe?
Okay, this one's a tricky one. It's again kind of on the cutting edge of where we may be going, and certainly there are some countries that are starting to do some of this. Currently, because we don't have great information yet on Johnson & Johnson, we're really acting off of AstraZeneca efficacy rates. There are some areas in the world doing second doses from AstraZeneca with a Pfizer or Moderna dose or an mRNA vaccine. We do not recommend that currently in the United States. There are not safety concerns posed by that practice, and we are starting to hear of individuals with an interest in wondering about that, but that is not currently a recommendation.
Okay, and we do need to shift over to Spanish, but I want to get to this final question from Facebook. Aren't kids less likely to have severe illness than adults? I have a hard time with the idea of making my kids get an experimental vaccine they don't want. Dr. Hoffman, can you address that very briefly? And then we're going to shift over to Spanish.
Sure. So, you know, I'm a pediatrician by training, and throughout the pandemic, we've minimized the fact that children are less impacted by COVID-19. The fact of the matter is children are impacted by COVID-19. They have, we've had, let me just pull up the data so we have it, correct numbers for all of you. To date in the pandemic, over 80,000, nearly 81,000 Utah children between ages 0 and 18 have gotten COVID-19. 729 of those needed to be hospitalized. 45 of those needed to be in an intensive care unit. And upwards of 100 individuals developed a severe multi-inflammatory syndrome called MIS-C. MIS-C is a serious condition that could lead to death. And in fact, we've had 2 deaths of children in the state of Utah. So it is not a non-issue in children. It is a disease that occurs in children, and it is associated with far higher hospitalization rates on the order of several flu seasons worth of hospitalizations for children with COVID-19 as compared to the flu. This is a serious disease for children as well. Thank you.
Thanks, Dr. Huff.